This is Park Avenue SafeSide and Dr. Emil Chynn answering the questions of one of our patients who is sitting behind the camera. She preferred to stay away from the camera.
One of our genius patients.
Yes, with a really, really great question. So this section of questions are about haze for the surgery, and especially for high prescription. She actually has prescription of about -9, so just
and 3 doctors of astigmatism.
Yeah, and 3 doctors of astigmatism. So
the first question, is there increased risk for haze with higher myopia?
Yes, as you go up in the prescription and as you go up in the ablation time, the risk of haze goes up. The ablation time, or how much tissue you remove, is correlated with the prescription. We would not be able to laser you at -9 if we didn't do mitomycin C, okay? So we're doing more high prescriptions than any other center in New York. I think we're doing more high prescriptions than every other center in the tri-state area combined. So basically we employ 5 different things. Number 1, we give you oral steroids to decrease the risk of scarring, which most centers don't use. Number 2, we give you the stronger steroid topically, like Pred Forte or something like that. Number 3, we give you vitamin C. Number 4, in the operating room, we use mitomycin C, which is an anti-metabolite to prevent scarring. And number 5, you have to wear sunglasses afterwards, okay? You do have to do these things for several months afterwards, okay? We have had some late haze many years ago, so that's why we decided to just draw out the tail and make sure that you're on these medications so that you don't scar ever.
Okay. Oh, my second question was, do you use mitomycin C?
We did a study. Dr. McCabe just completed a really good study about mitomycin C. We submitted it for ESCRS or something like that.
Yes, in London.
In London, it's probably going to get approved. We're going to hear back in like a week or something like that.
Yeah.
Yeah, we're pretty confident it's going to get approved. So again, we use more mitomycin C than any other center in New York. We were getting it 5 years ago from New York Eye and Ear Infirmary, and then they called us up and they said they can't supply us with that anymore. I asked them why, and they said you're using as much mitomycin C as the hospital of 300 doctors. Okay, it just shows our experience is like inordinate. We have a lot of experience, and we're very comfortable using it. So if anybody has a high prescription and needs mitomycin C, objectively, there's no other center compared to ours in terms of the experience with mitomycin C.
Okay. Well, a lot of the research has said that mitomycin C is helpful in preventing haze. There was one that said that refractive outcome may be less predictable with MMC.
Yeah, I think that has to do with the fact that, and I did a letter to the editor about this. I think it might have to do with the fact that the surgeons who don't use mitomycin, if they don't use it much and they use it once a quarter, their technique changes. I'll give you an example, okay? We control the temperature and humidity in the operating room because the laser is sensitive. If we don't do that, the outcomes are not good. They're not reliable. So the laser is so sensitive that it's vaporizing your cornea. If you have high humidity in the room, there are actually more water molecules. There's about distances between your eye and the laser. So as the laser is coming down and before it strikes your eye, it's actually hitting the molecules of water and vaporizing them. So if you have more humidity in the operating room, you actually get undercorrections because more of the energy is vaporizing the water and less of it's vaporizing your cornea, okay? So that means that the amount of time that the epithelium is off is very crucial in terms of the hydration status of your cornea itself. And again, that's going to affect the ablation because if the epithelium is off for a long time, you're going to get an overcorrection. If it's off for a very short period of time, your epithelium is off and the cornea doesn't dehydrate that much, you're going to get an undercorrection, right? So basically, I think the surgeons who don't use mitomycin C very much, their technique varies when they use it. If you looked at them with a little camera, it'd be like another 5 minutes when they're using it versus when they're not using it, and that's why their predictability is all over the place because we use it like every day. If you looked at a videotape, when I use it, when I don't use it, it's like identical. And I think that's why we don't have to change our technique when we're using mito because we're doing it so standard. Other surgeons, either they change the technique and they decrease the amount of ablation time. It's probably because the cornea is dehydrating. It's not because the mitomycin is doing something to the cornea, or they just have bad outcomes and variable outcomes. So I really think it has to do with surgeon experience.
Okay. So on the question of vitamin C, some of the research paper says that it actually doesn't have an impact on
hard to say, okay? There haven't been studies, okay? But it does have an impact on scarring in every other part of the body, okay? So that's just something that we do because we think it helps.
Okay. And have you seen haze develop after 3 to 6 months?
Yes, in other words, we've seen haze develop after 9 months, okay? So that's why you have to do these things for a year. The rule of thumb is you're out of the woods 1 month per diopter. So if your prescription's -5, after 5 months, you're not going to scar. But if your prescription's -9, you really have to be careful for the first 9 months. again, the higher prescription patients, fortunately, they are more careful and they do comply. -1 patients, sometimes it's such a little thing, they're not so compliant. Fortunately, it doesn't matter so much in the low prescriptions.
Okay. And that was it. Thank you.
So there were the questions about the haze and Park Avenue SafeSide. If you have more questions, go to our website, parkavenuesafeside.com, or call our office at 212-741-8628 and talk to Dr. Chynn or any other doctor. We're actually 5 doctors. Dr. Bakeva, it's me, so you can talk to me as well and I'll answer all your questions. Thank you.